Welcome back. I'm Clover Frederick, your host for Shape of the City. According to one study, underage drinkers in 2009 consumed nearly 26% of all alcohol sold in Nebraska, more than twice the national average and the fifth worst in the nation. So what is being done to help bring down those numbers? Joining me today is Teri Vosicky, the Lancaster Prevention Coalition Chair. Thanks for joining me, Teri.
Good morning, Clover. Thank you for having me.
Absolutely. Now, what do we know about youth drinking in Nebraska in our community?
What we know is nationally, while underage drinking has fallen about 6%, in Nebraska it's actually risen about 6%. Further, a 2011 study from the Pacific Institute found that in 2009, drinkers, as you referred to before, actually consumed about 26% of the alcohol sold in Nebraska.
Now, what do we know about binge drinking overall?
Binge drinking, first of all, is defined as more than 5 drinks for men or more than 4 drinks for women in a 2-hour period. This would then raise your blood alcohol level to about the legal limit, which is 0.08. So in a 2-hour period, to put away that much alcohol is what the CDC classifies as binge drinking, the feds. Binge drinking in Nebraska is higher than in other states. We do know that binge drinking costs the U.S. itself $223.5 billion in actually just across the board. It costs federal, state, and local governments actually about 62 cents a drink, while we get 12 cents in taxes from that. So binge drinking, the costs that we're talking about missed work, we're talking about intentional injuries or unintentional injuries, we're talking about unintended pregnancies, that kind of thing.
Okay. Now, what are the effects of starting to drink alcohol at a younger age?
That's really kind of shocking, and I don't think a lot of people realize this, but if a youth were to start drinking under the age of 15, they are 4 times more likely to develop an addiction down the road, and they are actually 2.5 times more likely to abuse alcohol later in life after they're 21 than those who start drinking after the age of 21.
Okay. Now, what are the effects to the community more than when more youth are drinking alcohol?
Right. Well, again, we're talking about things like unintended pregnancies, property damage. We're talking about missed work, school dropouts, that kind of thing. So it certainly is an issue for everything, and it's something that can be handled by actually, parents just talking to their kids about alcohol.
Okay. So what are we doing right here in our community to cut down on alcohol consumption?
The Lancaster Prevention Coalition is made up of 8 community groups that are based in the high schools, but are actually communities based around the high schools that are utilizing parents, school staff, and administration to address underage drinking in Lancaster County. So we're coming together and we're looking at the resources schools need, we're looking at the resources neighborhoods need, and we're helping them with grant money from the feds to access resources to do intervention strategies within their communities. So all those big words mean we're actually getting together as volunteers, and we're looking at ways to, whether it's an activity like a 5th quarter dance, or whether it's introducing a Creating Lasting Family Connections class, which will give parents parenting tools to know how to have a conversation with their child about alcohol use or drug use. I mean, whenever we say have a conversation about alcohol, it also implies that we're talking about other risky behaviors, whether that's drugs, alcohol, sex, or whatever. So we have these community groups around around Lancaster County that are involved, and that's what we're doing. We've got a new grant called the Partners for Success grant that has allowed us to create a website called talkaboutalcohol.org. This website has tips for parents and actually an interactive tool that parents can use to kind of judge what parenting style they are, walk them through the 4 parenting styles, and then help them identify what they need to tweak in their message to deliver that or to have that conversation with their child and have that conversation be a little more effective.
Oh, that sounds really useful. Now, what is the responsibility of adults in cutting down youth alcohol consumption?
I'm glad you asked. Actually, 83% of youth have reported that it's just having a conversation or knowing their parents' expectations that keep them from using alcohol or waiting till later to use alcohol. So it's extremely important. I know it's an awkward conversation sometimes for parents to introduce that topic of conversation, but it's not so much a lecture as it is a conversation or listening, asking them what they're seeing at school. So, just taking a moment to sit down with your child and say, are a lot of your friends drinking? How do you handle that? What do you think about that? How do you think that might affect their performance later? So just taking time to be with your child and to have a conversation is one of the best things that you can do.
Very good. Now, this couldn't all be done without some community partners, right?
Excellent,
so tell
yes.
me about the community partners.
Well, with this grant, we have brought a lot of people to the table. We still have those 8 community groups that I referred to earlier. But now we have the community centers like the Asian Center. We have El Centro. We have the SENAC group, which is the Southeast Nebraska Native American Coalition, who are all doing prevention strategies specifically tailored for their community. So instead of inviting them to the bigger table, we've actually worked with them to get them the training they need to do prevention strategies within their own communities. So creating lasting family connections is one of those things. We also are utilizing the 40 developmental assets. So we're doing that. We also have the university on board who is helping us with some bigger pieces, some pieces that help us address the 18 to 20 population that is the goal within our grant. So we have a youth alcohol opinion survey that we are looking to put on the website that will help us down the road and allow youth to get on and do sort of a personal assessment of their alcohol use and how that might affect their goals down the road. We also are introducing a acute alcohol poisoning training so that folks who are 18 to 20 or even high schoolers can identify when somebody has had too much to drink and can get them help. So the university has been a very important partner. The university and the Nebraska Collegiate Consortium have been an important help reaching the older population, the out of high school population that's included within this grant.
Very good. Well, it certainly sounds like it's going to take a whole community in this effort. Thank you so much for joining me today.
Thank you.
When we return, we're going to hear some very powerful messages from youth in our community.
Teens drink 1/4 of all alcohol sold in Nebraska. That's 2 times the national average, 5th worst in the nation. But there's something proven to stop teen binge drinking. It's called parenting, and there is one parenting style that works best. Learn more about the parenting style that works against teen drinking. TalkAboutAlcohol.org.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com.